Let's start with the COVID-related updates, with the highest ever single-day COVID tally recorded at 3,86,000 cases reported in the last 24 hours. Death toll in the same period is 3,498. That's the latest tally that India has recorded in the last 24 hours. Well, the Health Ministry of the Union Government has now rolled infection. What are the rules to be followed? That protocol is now laid out clear, especially for asymptomatic children, for symptomatic children with mild or moderate symptoms, and those with severe infection. So what we have given to understand is that the government has said that the asymptomatic children and mild symptoms can be treated under home supervision. Those with moderate and severe symptoms must be admitted to a COVID care facility. And the Health Minister has also laid down detailed protocol regarding the identification of infection and the kind of treatment that they should be given. Ayushman joining me on the phone line. So Ayushman, for the first time we have this kind of a blueprint now, a roadmap of sorts on what parents should follow if their children turn positive. Take us through the details, please.
Well, Afrida, it is the interim protocol which the Health Ministry has released, and this ranges between the children who are from 2 months old to 18 years. And in this, the broader guideline says that in mild cases, the home isolation works, and the adequate hydration should be there, and feeding, paracetamol, and if there is a symptoms grow, then you can report to the doctor if the worsening is there. But what exactly is changed from the adults is that even if in the moderate condition, which means if the child is having a increased breathing rate and 60 per minute, if it is there for 2 months old, then immediately that child should be admitted, and it should be monitored for progress, and fluid should properly be given. And if SpO2 is below 94%, then steroids should also be given. At the same time, in the case of severe illness, it has been pointed out that the admission must be there in ICU or HDU, and clearly the dosing regimen should be properly monitored. It has been said that somewhere prone positioning should be considered for all those children. So yes, Afrida, it is for the first time that children who are contracting the disease, we have seen in the first phase the number was less, but now the government even acknowledges that the number is increasing, and the virus is sparing no one. So if children contract COVID-19 at home, but if it goes into the moderate category, it has to be the child has to be admitted in the healthcare facility and treated accordingly.
Yes, and even if they have mild symptoms, they still need to isolate, since children can be carriers and they can be responsible for spreading the infection. So therefore, the identification and the isolation is important. Thanks for joining us, Ayushman.